Hello, I'm Robert Walker, fact checker for Doomsday Debunked, where we help people who are scared of various things. In this case, it's the COVID-19, the new virus, which now has a name. And so I'll give the link to this in the description. And this is about you can follow the World Health Organization daily press conference. And so I've been watching that every day since they started doing them. And this is my kind of summary of what he said. I'm just going to talk a little bit about what they said in that latest press conference. And there'll be a link to that in the description and also a link to the press conference. And if you want to watch the press conferences yourself, it's quite hard to find them. Actually, I think it should make them easier to find. But if I go to Tedros, I just got it there. Oh, there we are. Oh, I'll have to bring it up across like this. There we are. Tedros. So if you go to Tedros, the Director General of the World Health Organization, then he tweets each one of these press conferences. The WHO do as well, but it just gets lost because there's so many tweets there. And here's rather fewer, so it's easier to find. And it's better than the Facebook one because the Facebook don't seem to do them always. So anyway, so the first thing I want to talk about is this spike of 14,000 new cases. And if you go and look here, it looks very dramatic. So I'll just pop it over. It looks very dramatic, a big spike. But he explained in that press conference that it's not what it seems to be at all. These are not actually laboratory confirmed cases, which are just continuing like that. As you can see, the laboratory confirmed cases are sort of levelling off, and that's very, very promising. But these are cases going all the way back to the beginning, where they clinically looked like this new virus, but they just weren't able to test them because they haven't been able to test everyone. And just about everyone agrees, and that's just in Hubei province is the only place they're doing that. Everywhere else, then they've got plenty of tests. The number of people aren't overwhelming their testing capabilities, so they just test everyone. But they just can't do it yet because the test takes quite a long time to do, and especially for so many people. And so just about everyone has agreed that Hubei province and Wuhan, there are many more cases than they've actually been able to detect there. The big question is how many. And so this is not, they haven't managed to detect them yet. They've just decided to lump in all the cases since the beginning that looked like the new virus. But many of them may just be ordinary pneumonia and people just died of it, or people who, these are the cases, these aren't people who've died of it, sorry. These are people who just got it, and then the deaths has also gone up by about an extra 100 because of them adding in all the extra deaths back to then from what could be ordinary pneumonia, they don't know. So that's all that's happening there. It's not a big deal. And so unfortunately that means it's going to be, the graph is going to have a big kink in it, and from then on it'll be going at a higher level. I don't know what they're going to do about that. It's going to be quite difficult to kind of figure out what's really gone on because of this change. Maybe they will separate them out and have two graphs or something. But anyway, so now I want to go back to a bit more about that. So yes, that's it, just for you, Hubei, and this is my summary of what he said. And 1,820 laboratory cases, 30,332 clinically confirmed cases, and they haven't yet been able to separate out the deaths, so you can't take the deaths figures either as being all clinically confirmed, laboratory confirmed. They continue to see the same age spectrum, that the severe cases are for people of 40 upwards, and worst with each decade, so 8 years upwards is the worst, and men are more affected than women. So if you're young and you're a woman, then you're very unlikely to get a severe case of this, even if you were infected. So then another big question people have been asking is how much of an iceberg, he talked about it being the tip of the iceberg, that they know that they're not seeing all the cases, especially in Wuhan. And people wonder, outside of Wuhan, how many are we seeing? because they're seeing many mild cases outside of China, and they're not seeing them in Wuhan because it just overwhelms their testing their capabilities, and people wouldn't even just go in if you just got a little bit of a cough and fever for a couple of days. So how big is this iceberg? Well, he says that outside of China, and this is a new thing to me, then they've done tests in the emergency rooms of thousands of cases that weren't suspects. So if someone comes in with a bit of pneumonia, and then and if you're in Singapore, China outside of this region, or in Hong Kong, then you might get someone come in and says, we need to test you to see if you've got COVID-19, just as a routine thing, and they're just not seeing it. So if it was spreading outside, if there were different chains of transmission that they're missing, then they should have led to some, and especially if there were large numbers that some of these people, and this doesn't seem to work very well. So this epidemiological models where they work out that some of these people looking at what's been going on and trying to work back to China and then work forward again, they think there must be lots more cases, but this doesn't seem to be. There could be too many. The director, who was it was talking? I can't remember now, but he was very sceptical that, rather sceptical that there are as many as the epidemiologists think that there could be. He says that it's based on many assumptions, because they can't actually do the proper testing of people who've had it and have got over it, and maybe there's some mistakes in these assumptions. All the papers say that these based on these assumptions and these assumptions and these assumptions, but the actual experimental data doesn't suggest that there's large numbers of people who have got it or are slipping under the radar, because if there was, then they'd find them in the emergency rooms. Some of them would get the fever, and then they'd come to the emergency room and they'd have this, and then they'd say, oh, where did this come from? And they trace it back and try and find out. This just hasn't happened. So and also well over 400 cases out of China, 4 to 5 weeks outside China, and they only got 2 deaths so far, and only 22% of local cases. It's been going on for a long time, and 78% still have direct link to Wuhan or China, and none of this suggests that it's this kind of very spreading thing. It obviously was early on in Wuhan when they didn't know how to contain it, but now we know how to contain it. It really doesn't seem to be spreading very much in countries with good healthcare. He says there are only 8 cases that are not linked in some way to one of the identified transmission chains. So like there's that Chinese lady who infected 8 people, I think it was in Germany, and of course there's the Diamond Princess cruise liner, and there's a lot of people there infected. And but these are whenever they have a little local outbreak like that, they're containing it and quarantining it. And that's the biggest one, is that one cruise liner has more than anyone else has outside of China. But they're containing these outbreaks. And so, as long as it's going on like this, then it does suggest the iceberg is very small, and the only way they will know for sure is once they can do serology testing. And by the way, this article announced it, I'm not sure, I might add it to the links, but they're finding out quite a lot more about this thing, and I did talk a bit about that later. Anyway, once they can analyse the blood serum for antibodies to the virus, but it seems to be a little while before they'll be able to do that. And when they can do that, then they'll be able to go back and test people who had it even weeks ago, and they just go around testing everyone in the community and get an idea of percentage that have actually had it and got over it, and then they'll be able to get a much better idea of what's going on. But we won't know this for some time yet. Now, he talked a little bit about how they give policy and technical advice to all the countries, and he said that they work with they provide this support to every country, even the best healthcare. They still give them all the policy and technical advice they need. But they also work with countries with weaker healthcare, and he clarified a bit what that meant. So weaker healthcare meant specifically relative to this particular virus. So they worked out, how well could the country cope with, and what would their cost be for the first case, for the first 100 cases, and for the first 1,000 cases. So very systematic. And then they assessed all the countries according to how they could cope and what the costs would be, and then helped each one to build a national action plan, and their finance and the equipment they're sending out is based on this assessment. It's not just based on saying, oh look, Sudan doesn't have a weak healthcare system, but particularly how well would Sudan cope with containing the coronavirus and COVID-19. And then having based on that, they figure out how much support it needs in terms of equipment and finance. And so that's what they've been doing. And then that's what the 75 million was based on, $675 million. And that was a preliminary costing, and then they will now go back and forth with the countries working out on the ground what they actually need. They might find they've got some capabilities they didn't realise they had. They might find that they've assessed them as having capabilities they don't really have, and then based on that those numbers might need to be revised. But that's what it's based on. And their last outbreak response was in Samoa, and they had so many people, young children with measles, at the very end of the age spectrum. It's a small island in the Pacific, so north-east of Australia, and they had all the ventilators in Samoa were in use for young children during that measles outbreak. That was their last big one. And so they're looking into possibility of something like that, but at the other end of the age spectrum, where it might be that all the ventilators, when you got to, like, say if they did get to 1,000 cases, then it could be like that all the ventilators in Samoa and in Sudan and so on are in use again. They need more equipment. So that's the way in which they're doing it. So that's basically it. But at the moment, it's far easier to contain it now, and the figures do look decent enough that they are containing it. So they're on the cusp of containing it. You can see that from this curve, the way that it's. So if it was exponential, it would be doubling. We'd have a fixed doubling time. Every exponential is like that. You have a doubling time. If it doubles from there to there, then it doubles from there to there, and then of course keep on doubling up and up like that. It's not doing that. In fact, doubling there, it should have gone up like that, or something. It's not doing that. It's going up more or less straight, and then it's leveling. If anything, it's leveling off. And it's the same for if you look at the ones, those are the recovered. But the recovered are just a very delayed version. They recovered way back here. So the percentage that are affected, so right. So now you see, these are, even taking account of, that's a big leap because of the Diamond Princess. But even taking that into account, and there's another leap then, I think it's probably been Diamond Princess scale as well. I mean, this is from the data reporting. I mean, I've actually got it earlier on. As you can see, it's not going up like that. It's very much a straight line. Same number of cases each day. And that is what you expect when it's quite a bit under control. If there was a real outbreak, well, that is a sort of outbreak, the Diamond Princess, if you did it according to the epidemiologic, but a very contained one, and it's contained to the cruise ship. So if you had a proper one, you'd be like that, but it'd be like that, going right up, and that's not happening. So there's no sign at all. It's very good, looks very good. It's being contained. You're getting pretty much constant amount, and then it may well start tapering off because of a lot of these will be people, because of the increasing restrictions from China. Anyway, so stop there, and yes, say my usual thing. Do join the Doomsday Debunk Facebook group if you need help, if you're scared, and also if you could help, if you're good at reassuring scared people, and also if you're good at fact-checking and debunking, then we very much welcome you as well. For any if you join the group, do please read the rules at the top of the group. They're there for a reason, and they help you to function properly. And we're not looking for stories to debunk particularly, especially where we're not looking for stories to debunk, we're looking for stories if you're scared of something. If we were to go around searching the web for stories to debunk, then we would have a story every minute probably of daft things that people are saying. That's not what we're about. We're about helping people who are scared of something and want help with something that scared them. And if that's your fits you, then do join us. And if you are able to help people like that, then again, do please join us. Thanks very much for listening, and I'll put the link in the description, and also do subscribe to this if you want more videos like this.